Greetings everyone. Welcome to my channel. It's a pleasure to have you here, and I'm looking forward to discussing today's topic with you. Today I want to talk about an important health topic that affects all of us: salt intake. Did you know that consuming too much salt can significantly increase your risk of high blood pressure, heart disease, and stroke? In this video, we're going to discuss some signs that you might be eating too much salt. The typical American consumes about 3,400 milligrams of sodium a day. This is more than double the recommended limit set by the US Department. Before we get started, if you find this information helpful, please give this video a thumbs up and consider subscribing to our channel for more health tips and advice. Let's dive into the key indicators that you might need to cut back on salt in your diet. 8 signs you're eating more salt than you should. Number 1, constant thirst. When you consume a high amount of salt, it increases the sodium levels in your bloodstream. Your body tries to maintain a balance by pulling water from your cells into your blood to dilute the excess sodium. This process makes you feel dehydrated and prompts your brain to signal thirst, encouraging you to drink more water. Constantly feeling thirsty can be more than just an inconvenience. It can affect your overall hydration levels and potentially lead to dehydration if your body can't keep up with the demand for water. Dehydration can cause headaches, fatigue, and even dizziness. Your kidneys play a vital role in filtering out excess sodium and maintaining your body's fluid balance. When you consume too much salt, your kidneys have to work overtime to excrete the excess sodium. This can lead to increased urine production, which can further dehydrate you. Over time, this extra strain can impair kidney function and increase the risk of developing kidney stones. Number 2, swelling or puffiness. Swelling or puffiness. Have you noticed your rings feeling tighter, or perhaps your shoes don't fit as comfortably as they used to? This swelling, also known as edema, can be a sign that you're consuming too much salt. When you consume high amounts of salt, your body retains more water to balance out the extra sodium in your bloodstream. This water retention often leads to swelling in various parts of your body, such as your hands, feet, ankles, and even your face. This condition, known as edema, can be uncomfortable and sometimes painful. Edema can also affect your circulatory system. When there is excess fluid in your tissues, your heart has to work harder to pump blood through your veins and arteries. This increased workload can strain your cardiovascular system, potentially leading to more serious health issues over time, such as hypertension. Number 3, frequent urination. Eating a lot of salt can make your kidneys work harder to eliminate the excess sodium. This can lead to more frequent trips to the bathroom. If you notice you're urinating more often than usual, it might be linked to your salt intake. Frequent urination can also disrupt your body's balance of essential electrolytes like potassium, magnesium, and calcium. These minerals are crucial for maintaining normal muscle function, nerve signaling, and heart rhythm. An imbalance can result in muscle cramps, weakness, irregular heartbeats, and other serious health issues. Frequent urination can particularly affect your sleep, especially if you find yourself waking up multiple times during the night to use the bathroom. This condition, known as nocturia, disrupts your sleep cycle and can lead to poor sleep quality. Poor sleep can result in daytime fatigue, irritability, difficulty concentrating, and a weakened immune system. Number 4, kidney stones. Experiencing sharp pain in your back or side, along with nausea and blood in your urine, could be a sign of kidney stones. Consuming too much salt can significantly increase your risk of developing these painful stones. Sodium affects your kidney's ability to reabsorb calcium. High sodium levels in your diet lead to higher calcium levels in your urine as your body tries to expel the excess sodium. Calcium is one of the main components of most kidney stones. The higher the calcium concentration in your urine, the greater the risk of stone formation. Kidney stones can also cause nausea and vomiting due to the pain and the body's response to the obstruction in the urinary tract. This can further dehydrate you and worsen your condition. Number 5, high blood pressure. One of the most significant signs is high blood pressure. Consuming too much salt can cause your blood pressure to rise, increasing the risk of heart disease and stroke. If you've been diagnosed with hypertension, it's crucial to monitor your salt intake. High blood pressure forces your heart to work harder to pump blood, which can weaken the heart muscle over time. The constant pressure can also cause the arteries to become stiffer and less elastic, leading to a higher risk of heart attack, stroke, and heart failure. High blood pressure can damage the tiny blood vessels in your eyes, leading to hypertensive retinopathy. This condition can cause vision problems and, in severe cases, lead to blindness. Number 6. Frequent headaches. Eating too much salt is frequent headaches. High sodium levels can cause your blood vessels to expand, leading to increased blood flow and pressure in your brain, which can trigger headaches. If you notice that you're getting headaches more often than usual, it might be worth looking at your salt intake. According to health experts, the dilation of blood vessels caused by excess salt can also contribute to other types of headaches, such as cluster headaches or sinus headaches. These headaches may be more intense and localized, often accompanied by additional symptoms like facial pressure or congestion. Dehydration can cause the brain to temporarily shrink or contract slightly, pulling away from the skull. This movement can activate pain receptors and result in the throbbing sensation characteristic of many headaches. Number 7. Food cravings. When we consume high levels of salt, it can disrupt the body's natural mechanisms for regulating hunger and satiety. Salt triggers the release of certain neurotransmitters in the brain, such as dopamine, which are associated with pleasure and reward. This can create a cycle of cravings, where we seek out salty foods to experience that pleasurable sensation. Bone health. High salt intake can cause calcium to be leached from bones, weakening them over time and increasing the risk of osteoporosis. Salt, or sodium chloride, plays a crucial role in our body's function. It helps regulate fluid balance, supports nerve transmission, and aids muscle function. However, consuming too much salt can create a cycle of dependency and cravings. Number 8. Bloating. Bloating is the feeling of fullness or swelling in your abdomen, often caused by an accumulation of gas or fluids. While there are many potential causes of bloating, excessive salt intake is a common culprit. Sodium plays a vital role in maintaining fluid balance in your body. When you consume too much salt, your body retains extra water to dilute the excess sodium in your bloodstream. This water retention can lead to bloating and a feeling of puffiness. Severe bloating can sometimes make it difficult to breathe comfortably. The excess pressure in the abdomen can push against the diaphragm, the muscle that helps with breathing, making it feel harder to take deep breaths. Making small changes to reduce your salt intake can have a big impact on your health. Start by gradually cutting back on high-sodium foods and using salt alternatives. Your heart and overall health will thank you. Thank you so much for taking the time to watch my video. Your support means the world to me, and I truly appreciate each and every one of you. Creating content is a journey, and having such a wonderful audience makes it all the more rewarding.